Hi everyone, this is Janda Cheng from University of Michigan. Today I'm going to present our study entitled Anti-Inflammatory Effects of Sacral Stimulation, a novel spinal efferent and vagal efferent pathway. Inflammatory bowel diseases are common in America, affecting more than 3 million people, but the treatment is difficult, and more than 1/3 of patients would eventually have to go through surgical removal therapy. Recently, vagal stimulation has been proposed as a potential therapy for treating IBD by enhancing vagal efferent activity and releasing acetylcholine to balance inflammatory cytokines. The aim of this study was to investigate pathways and mechanisms involved in the anti-inflammatory effect of sacral stimulation in a rodent model of intestinal inflammation induced by TNBS. Our hypothesis was that in addition to its direct innervation to the colon via the pelvic splenic nerve, sacral stimulation may alter the colon function, mainly colon inflammation, by its spinal efferent and vagal efferent pathway. To prove this hypothesis, we measured the central neuronal activity and vagal efferent activity, and also performed bilateral vagotomy. As expected, bilateral vagotomy blocked the anti-inflammatory effect of sacral stimulation. This slide shows the area under curve of disease activity index in various groups of animals. TNBS-treated animals without stimulation, with stimulation, we could see a reduction in disease activity index. But in two groups of animals with vagotomy, sacral stimulation could not reduce the disease activity index. Similar results were found in the microscopic score of the colon tissue. Bilateral vagotomy also blocked the anti-inflammatory mechanism of sacral stimulation. Let's look at TNF-alpha. This is the control animal without the TNBS. With TNBS treatment, TNF-alpha was significantly increased, but sacral stimulation could reduce it. But in the two groups of animals with vagotomy, sacral stimulation was not able to suppress TNF-alpha. Similar results were found in other pro-inflammatory cytokines, IL-10, IL-17A, and also in anti-inflammatory cytokine IL-10. Sacral stimulation was able to enhance IL-10 compared with sham stimulation, but in vagotomized animals, such an effect was blocked. We also found that the sacral stimulation activated neurons in the NTS, as shown in the left figure, and also enhanced the vagal efferent activity assessed by the spectral analysis of heart rate variability, shown in the right. So in conclusion, sacral stimulation has an anti-inflammatory effect in the TNBS-induced colitis by balancing inflammatory cytokines via a spinal efferent and vagal efferent pathway. The finding of this novel pathway suggests that sacral stimulation may also be able to change functions of organs that are not innervated by the sacral nerve, but innervated by the vagus nerve. Thank you very much for your attention.